Well, hello there. This is Skip McCoy for Riversoft University. This video is about payer setup for hospice, hospice patient intake, and hospice patient scheduling. I'm going to start off right here, showing you how to put in a hospice payer. And this is going to be hospice paid for by Medicare. You'll just put in their address, NPI, submitter ID, payer class, which ECS style you're going to use to submit the 837. It's a UB92 claim type. Billing frequency is calendar, and you're going to enter the calendars in. This will give you complete control of when you're going to bill that month. Bill type mask is 81X. And then you're going to need these payer switches. Hospice, required diag to INV, required POC to INV. Include 2300 DTP 435. Blank SBR 04, and include SRC. Then, like all pairs, you'll need your allowed skills, and this is the basic set. You can enter more. And there's a special hospice skill with 4 sub-skills. Routine care is by far the most common, but there'll also be continuous, respite, inpatient respite, and general inpatient. Those are more rare. If you need those, you'll need to add those hospice and with the sub-skills of continuous, inpatient respite, and general inpatient. But if you don't need them, just enter this hospice routine care. Now it's going to be very important that for all these skills, you do not enter a bill rate, because hospice does not pay for the skilled visits. They pay at a level of service for each day, and you designate that level of service on the schedule using the hospice skill. And I'll show you how that works. So that's how your allowed skills should be set up. And your hospice routine care will have a bill rate. It'll have the only bill rate, and that is your annual reimbursement rate. It's updated every year, but this is your reimbursement rate for that level of service for that day. And they give you that by your MSA code each year. You'll have to update this value one time each year. Okay, that's setting up the payer. If you ever have questions setting up a payer, give Riversoft a call. We can help you set this up. If you give us a call, we can help you set your hospice payer up in about 10 minutes. Okay, next, now that you've got your hospice payer in here, you don't have to worry about it again until the rate goes up next year, hopefully. And now let's talk about patient intake. So it'd be right here. And patient intake works the same as normal patient intake, except you'll be associating your hospice patient to your hospice payer. It's very important that you designate the service location, because this value is used in billing. So you have to choose one of these hospice service locations. And if your patient is not being seen at their home, they're being seen at another site, we'll need the NPI value of that site and the name of that site, and you enter it just like this in the scheduling comment. That's more rare than seeing people in their home, but there is, if they are seeing a patient at a site other than their home, we need the information entered just like this. So hospice NPI colon, and then you'll need to get the NPI of the site, and you'll need to get the name of the site. So 3 small differences there for patient intake for hospice. Okay, so let's go take a look at a hospice schedule. Hospice is billed by the month, and of course it comes in benefit periods. The first 2 care plans are 90 days. The care plans after that are 60 days. And when you're scheduling hospice, for each day you'll put in a visit, a special visit that designates their level of care. And you'll always use the employee a hospice. You actually key in employee with the first name of A and hospice, and they'll have no pay rate. This is just a way that you can get this level of care visit on the schedule, so it's very visible, so you can tell at a glance what the level of care is. The bill rate is, of course, going to pull from the bill rate we stored for this skill and the sub-skill. So if we go back to the schedule, you'll see a level of care, and then there may be a visit that day. This is an actual visit, skilled nursing visit by an actual person. And your people are going to get paid, but you're not reimbursed for these visits, because this is hospice, again, It's kind of strange, like Medicare PPS. You're not reimbursed by the visits you do. You're reimbursed by the level of care during the day. Go back to schedule. Okay, and you'll keep doing that. Keep scheduling one visit per day for the level of care, and then schedule visits as needed. And that's basically scheduling. When it comes to, you can also add supplies here. Just right click, create a supply item, and you'll want to put in your hospice injectable drugs inside the supply database so that when you add a supply, all that you'll have to do is choose from this database and say save. Makes it very quick. There's an alternate way of importing supplies from your pharmacy, but that's going to be covered in the billing video. But that's basically the difference. Not too many differences in using Riversoft Office for hospice. Once you get that payer set up and you learn to do those minor differences in your patient intake and you learn to schedule, Riversoft Mobile will allow you to gather all your notes electronically for the hospice patient, change all your statuses, start of care, IDG admission, all the notes, the postmortem visits, the monthly billing, all that happens for you very easily. The next video will be about the notes, and the video after that is about billing and reports. This is Skip McCoy for Riversoft University, signing off.